Hi, I'm Dr. Chike Okolocha. I'm a DO and I work at Northwest Medical Group here in Valparaiso. Today, we're going to be talking about caffeine and how much you should be intaking once a day. According to the FDA, adults should be intaking no more than 400 milligrams of caffeine a day. If you're a teenager between 12 and 17 years old, according to the American Association of Pediatrics, you should be taking no more than 100 milligrams of caffeine a day. And if you're a pregnant woman, you should be intaking no more than 200 milligrams of caffeine a day. For reference, a cup of coffee contains 100 to 125 milligrams of caffeine. In addition to coffee and teas, which contain caffeine, energy drinks also contain excess caffeine, some as high as 300 milligrams per can. And sometimes these companies do not tell you how much caffeine is actually in these drinks. Caffeine is a diuretic and could interact with other drugs that could cause serious side effects. For example, hydrochloric diazide is used to treat hypertension. It is also a diuretic, which is one of the side effects. Combining that with caffeine, which is also a diuretic, will increase the risk of excess urination, which will increase the risk of potassium loss and other electrolytes as well. You're basically urinating your electrolytes away. So like you're urinating potassium, you're losing sodium, you're losing magnesium. If you have a history of deep vein thrombosis or pulmonary embolism, or just a history of blood clots, you're likely to be on an anticoagulant. Excess consumption of caffeine increases the risk of anticoagulants staying in the body longer because they're not being metabolized. This will cause an increased risk of bleeding and bruising. So people who are on the anticoagulants should be paying attention to how much caffeine they intake to prevent possible risk from happening. So to avoid the risk of excess caffeine consumption, do your best to read the labels, do your research, and understand how much caffeine you're actually intaking a day.